To be human is to know pain and joy of life. When one experiences pain or personal loss, to be able to recover and change and receive joy is another testament to the human spirit. However, everyone deals with pain differently and expresses themselves in different ways. Coping mechanisms are ways humans deal with trauma and pain in their lives. And there are many different mechanisms, good and bad, that can affect people's lives. Coping mechanisms like dependent relationship with others, activities, hobbies, exercise, and sometimes drugs, these mechanisms can be good or bad depending on how vital it is to keeping a healthy, sustainable life. This is difficult to define, however, because it's not easy to self-review yourself and see if you are negative or if your addiction is negative or a positive one in your life, especially when it comes to substance abuse or substance addictions. These can be a physical and mental necessity and common in one's life. Good day, my people! It's the King, Aaron D. Wiggins, and today I want to talk about addictions as a public health issue. For centuries, nations have talked about substance abuse through the forms of punishment. We penalize and imprison people who have become dependent on these drugs. Not only that, but we treat addictions as addicts as castaways or outsiders in our communities. This is because addictions can ruin lives and affect your judgment to make good or bad decisions. Recovery isn't easy either, yet there are numerous ways to achieve addiction-free lifestyles. It's all a matter of finding the right method for you. American Addiction Center has some of the best addiction treatment programs, diagnosis treatment programs, and group therapy to fight addictions. 12-step programs, trauma groups, grief groups, coping skills are just some of the few techniques and skills that you can apply to your life to better improve it. If you know someone or you yourself are struggling with these addictions, there are government programs that you can use to inform yourself and fight addiction. The Substance Abuse and Mental Health Administrations have formed organizations like the Southeast Addiction Technology Transfer Center Network. I'm glad that I'll be able to interview for my second interview discussing coping with addictions in America. Hey my people, it's the King, Aaron D. Wiggins, and I'm here with Celine Craig. She is from
SATTC, which is Southeast Addiction Technology Transfer Center, and we are funded by the Substance Use and Mental Health Services Administration, better known as SATTC.
Right. And so today we're going to be talking about is addiction or substance abuse, and you calling the perfect term for me or gave me a little correction.
So here at Morehouse School of Medicine and National Center for Primary Care, which is where we're housed, we don't use stigmatizing terms, so the language of recovery and the language of substance use, and we don't use abuse or misuse, it's use. Because the language is important, and that's the first step in the work that we do is that language cannot be stigmatizing, because stigma is the number one reason why certain practices and people aren't getting treatment that they need and just help in general is because of stigma. So stigma is the number one thing we're trying to overcome, so stigmatizing terms have to be gone. So yes, so substance use instead of substance abuse.
All right. And so that leads us to my first question. What are some setbacks or limitations that you guys are facing at SATTC?
So limitations in once it's here at SATTC.
Mm-hmm.
So limitations, I think that we come across. I think the number one thing would be stigma. It's hard for a lot of providers to kind of use new methods and kind of the community to really get to talking about substance use and addiction and recovery and treatment being real, and recovery is actually something real and it works, and that that's our message, and recovery is real and treatment works. And so I think a challenge is opening up the conversation. So stigma would be, I think a top thing that we're faced with every day, with just opening up the conversation.
Right. You don't want people to be shamed or
right.
feel like they're looked down upon when they're coming to get help for their issues.
Right. And then even talking with providers, certain providers, might be set in their ways, and some new, like medical assisted treatments have come about, and some providers, believe in maybe 12-step or abstinence-based detoxing things like that. And, that Medicaid-assisted treatment helps and it works. And we have to have that counseling piece in there with treatment and not just, the pill mill type thing. Those are a lot of the challenges that I hear when I'm talking with providers and also with communities, that they're like, yeah, this is like super big problem. I think another problem is resources. I know a lot of times it comes up about housing and transportation.
Okay.
So transportation to treatment and then recovery housing after someone has received treatment. We don't have enough resources maybe here in the Southeast, and then we need to expand them. So I think a lot of times that they kind of deters people from their retention in care.
Okay. Let me just some new terms that my viewers might not know. Can you explain a little bit more about 12-step program and what that actually is?
So 12-step is a method to treatment aside from medicated assisted treatment. And so 12-step is like a program that they go through with different interventions. I do not know the Google term right off top of my head, but they go through a series of different groups and sessions and learn how to do abstinence days. There's different methods. It's kind of like a modality for treatment that people use. And it could be, a lot of people sometimes go to 12-step in their communities, churches. It doesn't have to be in like a medical setting, and so it's kind of like meeting the person where they are, and there's different steps to like detoxing or recovery. It's like different steps to it.
So when overcoming substance use, there's not just cold turkey. There's other forms like medical treatment too.
Yeah.
All right. And my second question is, you guys accept donations at any time? I know you said some financial setbacks are some reasons why it's not as effective. Is there any ways the community can either donate or go into to donate to your cause?
No, we are government funded, so we actually have the money, so we don't accept donations. So we're actually the federal funders, so we actually are the ones that provide services, technical assistance, which is going out and providing trainings to organizations and providers to better assist them and equip them with the communities they serve. So we don't accept donations, no, because we're the government, no. But yeah, so other community partners probably do, but we don't.
So this is a key part, my viewers. There are NGOs, non-government organizations, those are nonprofits that you can donate your money to help them in their cause. But government organizations like SATTC, they get their money from your tax dollars. So this is one of the many things that your tax dollars go to, and one of many programs that are helping better society. So what are your guys' goals for the year?
So we actually just started year 3 at SATTC of a 5-year grant, and 5-year kind of cycle. And so we implemented 2 new strategic strategies last year, and so that was where we did a lot of our building and trying to figure out what did we want to do. And we had our motto was leveling up, and so that was for year 2. And so for year 3, it would be moving on up. And so that's something our director Don Tice came up with. Instead of leveling up, we're moving on up. And kind of building upon our initiatives. And so we have our faith initiative, which is called Let's Have the Conversation, One Voice, One Mission. And our second initiative is Minority to Priority, and that is a special populations initiative to bring light to special populations, specifically minorities, hence Minority to Priority, and women of color. And so those 2 are our top initiatives that we have going on. And then we kind of revamped our whole technical assistance piece. And technical assistance is really just a cute way to provide services, like a good name to provide services and trainings and webinars and the needs for our states that we serve. And so we revamped that, and so we have managers to cover the states now, and so really getting a real systemized way of how can we support the state in the work that they do, along with our communities, grassroots organizations that may need our assistance too. And so those are our top 3 things that we have going on. Of course, the podcast as well that we have, the New Voice of SUD. We're going to continue that.
Right, I was just on it. It's a great podcast. I even listened to a couple of other episodes. Get some really important information out there.
That was a plug. And then we have some new things that we're doing. We just want to be able, like my director always, states in our quota, like if there's 3 spots, we want SATTC to always be that spot that gets the money out of all the other ATTCs, which are Addiction Technology Transfer Centers. And so we just are always doing new things. We just did an event pop-up where we wanted to showcase who we were as SATTC here at Morehouse School of Medicine to the community. We want to collaborate with our universities around the Atlanta area and in our other states as well, to kind of build that engagement with workforce development and to really just bring awareness to what we offer, what the behavioral health and mental health field has to offer to young professionals as well. So we got a lot of cool projects going on. And I'm excited for the things we have to come. We always have webinars going on. We're always wanting to evolutionize our webinar game. So yeah. So we've been SATTC has been in existence since 1993, and so long term we just want to be able to secure money, secure funding. Not only for SATTC, but that's one of the goals of Morehouse School of Medicine is institutional advancement, to always be, thinking about the grants that we hold here at the institution level and at the department level with National Center for Primary Care. And so we're one of the divisions, and so we just love the fact that we're here at HBCU, and so we really want to just stay. So that is one of our main things, is to just keep that momentum going and perpetuity in the or institution and in the department.
So how do you approach a loved one if they have some substance use, or are there some tools that you can use yourself to, be aware of substance addiction?
So I think from I'll speak on my personal standpoint, but from an SATTC standpoint, as we are training professionals in the field and addiction and treatment specialists in the field, and the work that they do, we have something called SBIRT, which is a tool to actually identify if someone has a substance use disorder or opioid use disorder. So that's a tool that you can use clinically. But as far as in the home, I think you would be looking for, we created an infographic, shameless plug. We have a toolkit on our website where you look for those signs and symptoms. So if they're moving away from their loved ones, if there's some type of different moods, that this is normally not them, like loss of appetite, loss of motivation to do anything. There's a lot of different signs and symptoms physically as well, with your body. If there's
loss of weight.
Yeah. Fatigue, there's different things, all Googleable, of course, but yeah, I think the main tool is really your interaction with the person has changed, and their kind of their day-to-day routine. I mean, somebody's going different ways, or if they're not coming home, if they've missed work for 3 months, things like that are really key telltale signs that something might not be quite right, or that high and that low really jumping really quick from being really low depressive state to really manic high state. Those are things that I know I would look for in my loved ones. And if I had a loved one, then I think that would do it. I kind of would simply, I'm really straightforward, no chasing. I would kind of just say, you need someone to talk to. Let me know if you have anything. To open that door for conversation and know that there's not a stigma against if there is some type of substance use going on, and that they need help with. So I think kind of just always having those self check-ins. You okay? How you doing? And if it's an older loved one, just making sure that they're not overtaking certain medications, and we have that opioid use problem that we see an epidemic that's going crazy right now.
So if you see it affecting your life, or if you see it affecting someone else's life in a negative way, it's a good time then to step in.
Well, yeah, you wouldn't really know if it was negatively affecting.
Words are hard.
Yeah, I don't know why I'm not talking to it today, but I don't know if you would really know if it was negatively affecting until after the fact. So I think that beforehand, talking just regularly with someone would be more effective, in my opinion, than kind of after the fact. Like, oh, I see, you lost your job, that you've held for 20 years, like that. There would be a little too late. But there would be signs before something big and impactful like that, but yeah. So
what are some programs or some methods or policies that have been implemented? For example, in Italy, they decriminalized substance use, making it less of a criminal charge if you're getting caught with such like marijuana. what are some things in state or in the U.S. that you have noticed that have begun ways to better the community?
So I think a policy that was implemented in Louisiana is that you can bill for more than one mental health diagnosis at one time. Again, please don't quote me, but that was when I was talking to a Louisiana provider, because under the Opioid Response Network, which is one of the grants that we hold at SATTC, I cover Louisiana, Alabama, and Georgia. And so I really specifically focus on those 3 states and what their needs and challenges are. And so they were saying now, before they couldn't bill for more than one diagnosis on the, kind of like the bill, like a receipt for what they charge for and what they bill for in coding. So that's different. There's a lot of co-occurring disorders, so we can't ignore that and only bill for your schizophrenia, but we don't address your substance use problem. Right. That was something that was really big, and now the fact that you can bill for more than one thing, I think is awesome down in Louisiana, because I didn't think a lot of people knew that.
Right.
Another thing I think is this parity law that was put in place for behavioral health and mental health in general, of where you can bill for certain things, and why certain things aren't covered at the same level. I mean, now we're speaking on diabetes as being the same as a substance use disorder and handling it as such. So why aren't you able to get coverage for your counseling, or going to see an LPC, or going to get recovery treatment, or your MAT? Why? Medicaid assisted treatment is short for MAT.
And what is LLC?
Yeah, LPC is licensed practitioner or counselor. Okay. Professional counselor. So if you're going to see, certain people in the mental health and behavioral health field, you're able to get the same level of coverage in your insurance that you would for any other chronic disease, infectious disease, STDs, HIV, anything. It would be the same type thing. Before, we weren't seeing that. We were seeing where it was out of pocket, that it was so little coverage, like maybe $50, right, and you paid the rest. So really cool out of that parity law. And we actually did some work in our research department here with health research and policy at NCPC and MSM, where Megan Douglas talked about that in detail with the parity law, about that health equity factor where you're.
What are some ways we as citizens can do to help decrease substance use in America?
I think that we can decrease. This was like one of those Miss America questions. Thank you. Right. I think that decreasing really honestly would be to address the local issues that are faced. I mean, I know in the African American communities, which we focus on, there are underlying reasons why we use substances to cope with other things that are going on. And so I think any type of positive programming in our communities is kind of deterring us from using substance use. And I think that CATCA, which is Communities for Anti-Drug Coalitions of America, I think they do an awesome job at anti-drug use and drug prevention. And so a lot of what they do is just really focusing on the youth and actually programming where they are not so focused on using drugs and other substances that might be affecting them. So I think that starting with the youth and prevention, that would be definitely ways that I think that we could kind of like circumvent the problem and start really before it happens. And really, programming for people that are dealing with it as well. But I think that, yeah,
destigmatizing, getting help, or asking for help. Okay. Another question I have is how do we are there any affordable ways to treat substance use for low-income citizens? I know another stigma is that it's a rich man's problem being addicted to substances. Mm-hmm. Not a lot of poor people can either do that, or they're going to get themselves into homelessness.
Yeah.
But are there any programs that are for low-income citizens?
So I think that varies from state to state. I'm not sure about actually what is covered here in Georgia, but I am a little bit familiar in Louisiana, because I deal with a provider who actually knows about a lot of grants. And so Medicaid, I think in a certain grant, Medicaid in that area will They will cover, I think, 30 patients, and they'll see them for free. They'll allow them to see a provider, and the provider will get, monies from the actual government off that, not from the actual patient. So I think that's a really good way. I'm not sure many in Alabama either, but I do remember Dr. Jones briefing me on the fact that Medicaid, actually, there are ways and grants for sure where Medicaid will come in and cover the cost to ensure that about 30 to 40 patients can get Medicaid assisted treatment.
Okay, cool. All right, so final question. I know there are some different forms of addiction treatment and different ways that we can get off more addictive substances like painkillers. There's some merit about medical marijuana. Are there any other substances or treatments that you know of that are better to curb substance abuse or substance use?
So it depends. So I'm a bio major by trade, so it's different ways to treat different substances. What you would treat for a alcohol, disorder would be different from, like opioid use disorder. So there's different ways to treat different things just based off receptors and how they hit different receptors based off the drug. But there are alternatives for opioid use in particular. There are alternatives that people use, the patches. There's different ones. Marijuana, I know, is a really big thing. It's not evidence-based when it comes to treating opioid use disorders, and I know under a lot of the grants that's typically not something that we lean towards as far as being like a modality to treat.
Okay.
Because it's not evidence-based. Everything's evidence-based when you're doing government work.
Right.
So it has to be evidence-based, proven, factual, like multiple times through repetition. So, and then I actually heard from a physician in Georgia that they actually found out that either vitamin C actually tickles the same receptor, and so when you are actually getting medical assisted treatment for opioid use disorders, coupling that with vitamin C helps it take better or something like that. So that was really interesting to know. And psychedelics, I know we were talking about that earlier before we started, that he also stated that as well. So that's something that's catching on, that those are used as well to treat. But yeah.
Okay, I want to thank you. You guys are my first government organization that I worked with or interviewed in this case. And I want to thank you for being here and being part of the channel.
Sure.
Can you please tell me where you can find more information about what you do and where you're at?
So we are the Southeast ATTC, so you can go to attcnetwork.org. We are on all the social media channels except for Instagram. So we have a Facebook, we have a Twitter, we have a LinkedIn, and we also have, I think that's it. Oh, we also have a YouTube channel, but that's mostly where we house just webinars. But check it out as well. But you can check us out on most social medias, but definitely attcnetwork.org, and then you can go to all the centers, and it'll show them by region, and then we're Southeast.
All right, and then I'll see you guys next time. And that wraps it all up, but until next time, I'll be with you.